Hello there, YouTube. Matt Ely here. I am not making an end myopia video. I'll do another one of those someday, but not what this is about. I'm basically making this video for a friend, and it seems interesting to post on YouTube as well. He is dealing with some shoulder pain that he's trying to figure out, and I am dealing with some irritation in this elbow here from doing too many pull-ups with poor form. And so I'm working through getting this fixed and strong again so I can continue to train that exercise. And this part of what I'm doing deals with relearning the proper form for the exercise. So here's a bar, and this is just going to give a for instance. If I'm grabbing the bar and my default position is something like this, or this, if you can see how my hands are not wrapped around the bar, it shows that this puts my shoulder in a position where the pull-up or the chin-up, either way, is becoming more of an arm exercise than a back exercise, which is what it's supposed to be. So if rather I wrap my hands around the bar and I'm able to pull my shoulders back, then eventually I'm engaging more of the back when I do the exercise, and also distributing that pressure on the arm more appropriately and more evenly. So what I'm doing is I'm regressing the exercise with two things in mind. The first is always stop short of joint pain. And I don't know exactly what this is going to look like. I'm going to do body weight rows, not fully vertical yet, because I'm going back to the very beginning of if I couldn't do a pull-up at all and I were training up to do it, this is one of the progressions I could use. So I'm going to go and do that, and I will be doing this pulling exercise, trying to focus on engaging the muscles in the back and keeping my shoulders back so that it's a back exercise and an arm exercise. And if at any point in the motion here I get to where something hurts, I will back up and just hold there and do what's called an isometric contraction, so that I'm not experiencing pain, but I still get to train the muscle. If you research isometrics, they can be very therapeutic for rehabbing joint injuries. I'm going to move very slowly, and hopefully this will be able to be seen. We'll see how it looks, but this is a demo of what I'm doing, and I'll name some other exercises I'm going to work through as well. But here we go. So I've got a suspension trainer thing here. I'm going to angle my body to make this as much of a horizontal rowing motion as I can. And I'm moving very slowly. Up and back. It'll be difficult to talk the whole time. Right there. Feels good. Okay, so that's not too difficult. Trying to move slowly and with control. And that feels very comfortable on that elbow. If I were to do chin-ups or pull-ups right now, I could do 7 or 8, but in the upper range of the motion here, when I get past here, this elbow would still hurt. So I have to give it rest and not do anything that aggravates it, while gradually building up with proper technique and proper form. That's one thing I'm doing. The other here, other exercises that are important for working that joint are things like, and I'm trying to move to where I'm blocking the light there that's making this back lit, is wrist curls and wrist extensions. I can do this. This feels perfectly fine. No pain. I can move through these ranges of motion. Elbow feels good. But when I put a certain amount of stress on it, it hurts a little bit. So I have to give it rest while still strengthen it. So for the wrist curl, what I'm going to do is support the wrist and start pulling up. I'm giving resistance with my other arm just to the point where if I feel any discomfort in the elbow joint, I'll stop then. Well, this feels fine. I can gradually ramp up over 45 or 60 seconds to where I'm doing this as hard as I can. Which then tells me, once I'm comfortable with that, then I can start to add actual resistance with a weight or a resistance band or something like that. Same thing if I'm doing a bicep curl. I'm going to regress the weight. Also trying to be mindful of my back and my shoulder position. I'm going to regress the weight and move slowly under control to a point where I can do this with no discomfort in the joint, and then reprogress from there. So I'm strengthening the muscles and the connective tissue that supports the joint while not putting enough stress on it to irritate it. That's the thought process. We have to be like a detective with these things, and this is going on YouTube, so it goes without saying. Go see a doctor, go see a physical therapist, make sure you don't have some serious injury that needs more attention. Once you do that and you know that you're on the right track, you're going to have to do some of these exercises on your own anyway. Isometrics, like I demonstrated there, are a fantastic way. If I were doing the bicep curl, I can do this because I'm in complete control of the resistance. And if this were very painful to try to do all the way, I could just gradually press up. Again, right to the point when I start to feel a little discomfort, back up, hold, and press. It's increasing blood flow to the area, which is very therapeutic. It is strengthening the muscle and the connective tissue at the level that we're ready for now. Give it rest, but challenge it too appropriately. Hope that makes sense. As far as YouTube goes, I probably don't read the comments. My oldest child is a girl. When she found out that I had a YouTube channel, she was really excited. And she said, "Dad, you got to get to 500 subscribers." I said, "I don't really care." She wants me to make a video. She was concerned because I hadn't made one in a year or something like that, that YouTube might take it down. So here's a video. Doesn't make one bit of difference to me if you subscribe or if you don't, but there's a 9-year-old little girl who would be delighted to see her daddy get to 500 subscribers. Take your pick. I'll do another in myopia video someday, but this is what I'm doing to try to get this elbow back in shape to where I can do pull-ups and chin-ups and get stronger than I was before. Hope that helps.